Good evening, everyone. So, I welcome you all to this FB Live by Dr. G. Vishwanathan, CBCC Cancer Center, Trichy. So, I hope all of you are safe and sound. So, today, as we know, our topic of discussion is the role of radiation therapy in treating gynecological cancers. And for that, we have an experienced and renowned doctor with us, Dr. Gowthami Venugopal. So, Gowthami Venugopal is a consultant radiation oncologist at Dr. G. Vishwanathan CBCC Cancer Center, Trichy. She completed her MBBS from Kakatiya Medical College, Telangana, and later completed her MD in radiation oncology from Nizam's Institute of Medical Sciences, Telangana. She has extensive hands-on experience in planning and implementation of 2D, 3D CRT, IMRT, and BMAT plans. Her areas of interest include gynecological cancers, lung cancer, and breast cancer. So let me give a warm welcome to Dr. Gowthami. Welcome, Doctor.
Welcome. Thank you.
So, Doctor, it's a privilege to have you here. Thank you so much for joining.
Thank you.
So, Doctor, any welcoming remarks for our viewers?
Uh, Welcome everyone. Today's topic is an interesting topic, and I want everyone to get benefited from this session.
Surely,
I hope
surely, Doctor. Yeah. So, Doctor, can we start with the questions?
Sure, ma'am. Sure.
Yeah. Okay. So, my first question to you is so it's the umbrella question. What is the role of radiation therapy in treating gynecological cancers?
First, I wanted to tell what all cancers come under the preview of gynecological cancers. So, under gynecological cancers, the first main cancer is cervical cancer. That is the second most common cancer affecting women in India, and next comes ovarian cancer. That is the third most cancer affecting women. First is always the breast cancer. After cervical and ovarian cancer, we have vaginal cancer, vulvar cancer. Okay, so cervical cancer, treatment depends on the stage of the cancer. Okay, so stage one cancer, mostly treatment will be surgery followed by radiation therapy. Stage two, after stage two, it is called locally advanced cervical cancers, which cannot be treated with surgery. So treatment will be upfront radiation. Same comes for vaginal and vulvar cancers. If the stage is initial stage one, then the treatment will be surgery followed by radiation therapy. If it's locally advanced cancer, treatment will be uh, radiation therapy upfront. Coming to
Oh,
ovarian cancers, the role of radiation is very less now. Mainly, the treatment will be surgery and chemotherapy.
okay, okay, Doctor. So, Doctor, thank you so much for letting us know what all cancers come under the umbrella of gynecological cancers. So, my next question to you is how is radiation therapy administered to patients with any of the gynecological cancer?
Coming to the types of radiation therapy, there are two types of radiation therapy. One is depending on the modality. One is external beam radiation therapy, and other is brachytherapy. External beam radiation therapy, the radiation source is outside the patient, and the radiation rays goes inside the patient and treats the cancer. In these two modalities, previously we were using cobalt 60 teletherapy. Now, latestly we have linear accelerator. In linear accelerator, we are not using any radiation source, but we are generating radiation through electricity. So there is a linear accelerator machine. On the linear accelerator machine, we treat the patients. Coming to another one, that is brachytherapy. In brachytherapy, the radiation source is placed inside the patient's body, so that the tumor is treated. So there are two types. One is linear accelerator teletherapy and brachytherapy.
Okay, Doctor. So, Doctor, my next question is so if a person is going through some cancer and the doctors are administering the radiation therapy, so what are the potential side effects that a patient can experience?
Okay. Uh, the thing is, always patients are concerned about side effects of radiation, but the radiation therapy is more patient friendly than surgery, to be frank. So patients need not be concerned about the side effects. Those are all manageable and easily treatable side effects. Okay.
Mm-hmm.
During radiation, the side effects are caused because, along with the tumor tissue, some part of normal tissue is also comes under radiation. So the normal tissue effects of radiation, those cause the cancer. I mean, those cause the side effects. In gynecological cancers, when you are treating either cervix or vagina or endometrium, the main thing is the in front of the gynecological tissues, we have urinary bladder, and posterior to it, we have rectum. So during radiation therapy, the avoiding bladder and rectum is not totally possible. So some part of radiation will go to bladder and rectum. So these causes the side effects. Mainly, if due to those to urinary bladder, we will have cystitis and some burning micturition. During when the radiation affects the rectum, we will have radiation proctitis, and we will have irritation, and patient will have mild discomfort during when passing motion. Along with that, some part of bowel also comes under radiation when treating gynecological cancers. So patient will experience some discomfort in the abdomen, and some patients may experience loose stools. Other than that, severe side effects are not generally expected in treating gynecological cancers.
Okay. That's a great thing to know, doctor. So, my next question is, how does radiation therapy impact a patient's quality of life during and after radiation therapy, during and after cancer treatment?
During radiation, the main symptoms patient feels are fatigue. Patient may feel tired, patient may feel dehydrated. So we always advise patients to take adequate hydration during treatment. And when other than that, we advise them to have a bland diet. We advise them to have a less spicy diet, because to avoid GI symptoms. Other than that, we always advise them to have a lot of water to avoid burning micturition. I mean, difficult. Uh, I mean, burning sensation when passing urine and all. Uh, they have this mild discomfort. Other than that, their quality of life is always good.
Okay, doctor. So, doctor, next question जो है, it is what advancements have been made in radiation therapy for gynecological cancers in recent years?
Yes. Uh, Coming to radiation therapy, there are different techniques we have been using. Previously, we were using two-dimensional radiation therapy that was based on the bony landmarks. So it was not according to the individual patient. It was according to the bony landmarks, and a lot of normal tissue also comes under radiation. So we used to have a lot of side effects. Now we have, from two-dimensional therapy, we have moved on to three-dimensional conformal radiation therapy, where our radiation planning is based on a CT simulation, and the radiation therapy is planning is all computerized. So so before implementing the patient on radiation, we are able to see what all doses the normal tissue gets. So we are able to see how much dose is going to the normal organs, how much dose is going to the uh, tumor tissue. So we are able to give constraints, and we are able to modify the plan so that the normal organs like urinary bladder, rectum, and abdominal bowels, uh, intestines, they all get less dose of radiation, and the tumor tissue gets a maximum dose of radiation. So because of this planning beforehand, because of this conformal treatment, we are able to minimize the side effects and maximize the dose to the tumor. So conformal techniques we have got, and now we are using IMRT, that's an intensity modulated radiation therapy, that has become the standard of care for gynecological cancers now, especially in post-op settings. In radical settings, both 3D CRT and IMRT are equally good. In this, we are giving the radiation tissue conformally to the tumor, and we are minimizing the doses to the adjacent normal tissues. So we are able to uh, plan our radiation beforehand. That advancement has been made. And coming to brachytherapy, in brachytherapy, previously we used to do 2D brachytherapy, where we were not sure of the doses to the adjacent tissues. Now we are using 3D brachytherapy, that is image guided brachytherapy, where we are, after placing the sources, we are able to see how much doses is going to the other normal tissues. So we are using uh, image guided brachytherapy. That is the latest one now.
Okay, okay, ma'am. So, next question is, what is the success rate of radiation therapy while treating gynecological cancers?
Success rate always first depends on the stage of the tumor. In cervical cancer, from stage 1B to 4A, we are treating with radiation, and along we are using with chemo radiation. So the success rate always depends on the stage of the tumor. In initial stages, locally advanced stages, stages 1, 2, and 3, we are able to achieve good survival. Our 5-year survival rates are around 80 to 90%. So the success rate mostly depends on the tumor biology and how good the patient is taking the treatment. And it also depends on the chemotherapy we give along with them, their performance status. So in general, if you compare it with surgery, the results are equally good.
Okay, okay. That's a great thing to know, doctor. So, I'm done with my set of questions. Let's see what our viewers have to ask. So, can we proceed with the viewers' questions? Yeah. So, first question is from Asha Nandini Nandakumar. Uh, what is the difference between chemotherapy and radiation?
Chemotherapy is we are giving some cytotoxic drugs which act on the cells. So those chemotherapy is, to tell in the layman words, it's some injections, some tablets. Those act on the systemic body. Okay, either in the form of chemotherapy, can be in the form of either tablets or injections. So those act all over the body. Okay,
Mm-hmm.
that is chemotherapy, and that is one modality of treating tumors. Coming to radiation, radiation is we are using either photons, even protons we are using now. So that is to localize it to the tumor. It doesn't act systemically. It doesn't act everywhere in the body. So we are focusing it towards the tumor. That
Mm-hmm.
is one modality of treating tumors.
Okay. Next question is from Siddhant Tripathi. He's asking, can radiation therapy for gynecological cancers affect fertility or pregnancy in the future?
Yes, that's a very good question, because that's a common question women ask in our OPD. So mainly gynecological cancers, especially cervical cancers, are seen in women around 40 to 50 years of age, after 40 years of age. Previously we used to see after 50 to 60 years, but the age has definitely come down. So if the patient has uh, completed her fertility, I mean, has completed her childbirth, then there is less issues. So
Mhm.
radiation is generally covers uterus, vagina, ovary. So during treatment, we have to cover all these areas. Especially for fertility, we require ovarian function. Ovary is a very, very radio sensitive structures, and doses around 7 gray is also radioablative, means the ovary will not function in the future. But for the tumor to kill the tumor, we have to give around 50 gray of radiation.
Mhm.
So definitely ovary uh, will ovarian function will be affected with radiation. So we have to see if the patient has completed her childbirth or not. So if
Mhm.
at all the patient has completed her childbirth, then it is not advisable to spare the ovary. It is always advisable to involve the ovary in the radiation field. But suppose if the patient is young and she has not completed her childbirth, then we have to see options uh, where we have to spare her fertility. So what are the options we have is, we can one option is oophoropexy. That is, we are uh, removing the ovary from its normal place and we are placing it in the abdomen somewhere else with surgery, so that it doesn't come in the radiation field. That we can do.
Mm-hmm.
So ovary will not be in the radiation field. It will be a little far away from the radiation field, so that ovarian function can be preserved. That is one
Okay.
option. Surgically, we can do that. Another option is ova preservation. In if there are a lot of options in ova preservation. One is oocyte preservation. From ovarian tissue, we can remove, we can harvest some oocytes, and like blood bank, we have sperm bank, we have ova bank. Like that, we can store the oocytes for future preservation. Other option is we are taking the ova and we are fertilizing it with an sperm and we are preserving the embryo. That also we can do if the patient is married, and then preserve it with embryo. Embryo preservation has good success rates in the future, more than the oocyte preservation. So oocyte preservation is also there, but embryo preservation will be helpful later. So with this, we can preserve their fertility, and then we can go for the treatment, radiation treatment. After
Mm-hmm.
that, we can consider surrogate mother with this ovary. We can later plan surrogacy also. So there are
Mm-hmm.
options. It's not like once we give radiation, we cannot uh, have a child in the future. No, we can have plan if the patient is I mean has not completed her childbirth, then she can preserve her ovary, she can preserve her ova, or she can preserve her embryo. In a ova banks are available now. So before treatment we can do that, and later we can start with radiation.
Very insightful, doctor. This is a great news to know, I think, for all the women. So, next question is from Mehal Patel, and she is asking how important is it for patients to receive follow up care after undergoing radiation therapy?
It is very important to have a follow-up care, because radiation is mostly late acting treatment. Okay, during the treatment sessions we see less of acute side effects. After completion of radiation therapy we see lot of long-term side effects. So to assess that, we generally ask the patient, we review the patient every week during radiation to see for acute side effects. After discharge, after completion of radiation therapy, we review them every week for the first 4 weeks to see for long-term side effects. Then we assess for every month after that for side effects. So generally, after treatment, 1 to 2 months is very crucial to manage the side effects, because patient doesn't generally know these are the side effects, these are the effects of the tumor, these are the effects of the recurrence. So we have to assess them and tell, no, this is a part of treatment, this is a part of treatment of radiation, and this is not part of tumor recurrence. So we have to see and we have to reassure them, we have to give them supportive treatment for them.
Mm-hmm.
So after radiation treatment, we assess them every week for a month. After that, every month review will be sufficient for.
Okay, doctor. So, next question is are there any specific risks associated with radiation therapy for elderly patients with gynecological cancers?
Uh, for this, in general, the elderly population is what they are, what are affected with gynecological cancers, and they do not have any specific side effects or high risks for radiation therapy. In general, what all side effects I have previously mentioned, like uh, difficulty in passing urine or difficulty in passing stools, those are the side effects we see in them. No, they are not at very high risk. They, in general, radiation therapy for elderly patients, they do tolerate well. One thing is they have some acute skin reactions. Those are all manageable.
Okay, okay. Next we have is from James Bose, and he's asking, can radiation therapy for gynecological cancers affect a women's menstrual cycle, and if so, how it is managed?
Especially gynecological cancers like endometrial cancers, cervical cancers, they all affect post-menopausal women. So the woman has already completed, has achieved her menopause, and if at all the patient has is in a premenopausal age, radiation will definitely affect her menstrual cycle. It will induce permanent amenorrhea. Means if in future, because it will affect the ovarian function. Ovary will also definitely come under the radiation field. So ovarian function will not be there. So patient will go into amenorrhea and later she will develop menopause.
Okay. Next question is from Jigar Purohit. He's asking, are there any lifestyle changes that patients or a cancer patient can make during radiation therapy to improve its effectiveness?
Yes, some definitely they have to make some lifestyle changes. One is they have to have a bland diet so that their
Mhm.
bowels are soft and that doesn't affect their the treatment. And one thing is weight management. They have to see that they don't put on weight so that there are no acute skin reactions. Um so maintaining a healthy weight and having a fiber-rich food is what is necessary. Other than that, they can have their normal lifestyle.
Great news, doctor. So, next question is from Asha Nandini Nandakumar. So, I think they are asking for the second time. Do gynecological cancer occur with people who have not n- her
Have not had menopause.
nerd menopause? What person of your, I think, what part of the women affected? She's trying to say yes.
In cervical cancers and endometrial cancers, mostly it's seen in postmenopausal women. Cervical cancers in premenopausal women is around 10 to 15% only. Mostly
Okay.
it affects postmenopausal women. In premenopausal women, in young patients, we do see cervical cancer. It's not that way, but it's in a minority only.
Mhm.
So,
Okay.
the treatment doesn't depend based on the age of the patient. It depends on the if the patient wants to preserve their fertility or not. So, suppose if the patient wants to preserve their fertility, if patient is in very initial stages of the disease, we do offer fertility sparing surgeries. Fertility sparing surgeries can be done, but if the patient is not a surgical candidate according to the stage, then we do what I said, like ova banking, we can do embryo banking, we can do. After that we can start radiation treatment.
Okay, doctor. So next question is from Bala Kumaran Govindaraj. Uh, what are the benefits for a radiation therapy before chemo or after chemo?
Okay. So, both radiation therapy and chemotherapy are modalities for treating tumors. Some chemotherapy are make the, I mean, they act simultaneously along with the radiation. They enhance the effects of radiation. So those drugs we give along with radiation. Some drugs act individually irrespective of the radiation status. So some drugs are there like platinum analogs. Those category of chemotherapy we give along with radiation to enhance the radio sensitivity. I mean, they enhance the radiation effects. They make the cells more radio sensitive. So those chemotherapy drugs we use along with radiation, and that is called chemo radiation. In general, for gynecological cancers, if the patient is fit and there are no much comorbidities, we prefer chemo radiation than radiation alone. if the patient is not suitable for chemotherapy, if the patient performance status is poor, if their um, general condition is poor, then we go only for radiation. But in general, for gynecological cancers, chemo radiation is more preferable.
Okay, okay, doctor. Next question is from Dinesh Kumar, and he's asking how well India is advanced in cancer treatments. So it's a very generic question, but if you can answer.
Yes. Uh, India is at par with the world in treating cancer treatments. Every for possible treatment to treat cancer, like surgical, advanced surgical treatments, advanced radiation treatments, advanced chemotherapy, immunotherapy, everything is available in India. If you are specific to radiation, we should be proud. We have photons and protons available in India. Uh, so India is at par. I should know. India is in no way less than other countries in cancer treatments in the world.
I think a world-class level of quality cancer care. We are also providing. So CBCC India is also providing the international standards of quality care in India. So yes, we can say that we are at par with the world.
Yes, we are at par. We are at par.
Yes, yes. So next question is from Subhajit Das, and he's asking what foods are more or what kind of food are more beneficial for our body during radiotherapy. So if a person is going through a radiation therapy, cancer patient, what should be the diet plan or what foods are more beneficial during the treatment?
In general, food there is no much relation between food and radiation. But in general, cancer patients are advised to have a high protein diet. So protein supplements and protein rich foods are what encouraged during radiation. And more with we have to concentrate more on the dehydration part because they have radiation along with chemotherapy. So patients tend to have some loose stools, tend to have some vomitings, so they get dehydrated easily. So we have to mainly concentrate on their hydration. So I will like to say patients should have more amount of water than what they normally have, and concentrate on fiber rich food, and in general a high protein diet.
Okay, doctor. So I think we are done with the viewers' questions too. So thank you so much, Dr. Gauthami. Thank you so much for delivering a wonderful and insightful session. And thank you so much. So any concluding remarks for our viewers?
Uh, Concluding remarks, I want to say that patients need not fear of radiation treatment. There are a lot of misconceptions about radiation treatment because radiation treatment has advanced much beyond what was previously there. So uh, patients in general still they ask if radiation is compulsory, should we opt for a surgical treatment? So I would say radiation treatment is much better than surgical treatment. So when indicated, you need not fear of radiation therapy. Radiation therapy is generally tolerable. Uh, the side effects are tolerable and equally good results, and even better results sometimes. And coming to quality of life is good with radiation therapy. Some minor setbacks are there. I won't say that there are no side effects of radiation. Some minor side effects are there which are totally manageable. So suppose if some woman is diagnosed with gynecological cancer like cervical cancer, endometrial cancer, they should take treatment properly. And if radiation is indicated, radiation is advised to them, they do not fear of radiation. uh, so it's like so patients somehow get convinced for surgery, but when they are told that they require radiation, they have a lot of misconceptions. So I want to tell them that radiation treatment is also will be beneficial to them, so they do not be fearful of the side effects.
True, doctor. So with right treatment and right guidance, there's nothing to worry about.
Yes, yes, we can win this battle. Yes.
So, thank you so much, Dr. Gauthami, and thank you so much, viewers, for joining us. And if you or someone you know ever need a cancer consultation, you can definitely visit Dr. Gauthami at Dr. G. Vishwanathan Cancer Center, Trichy. So, thank you so much for joining us. Thank you so much, Doctor.
Thank you. Thank you.
Thank you.